All right. Welcome to our weekly new global media talk show. Today is December 29, 2024. New Year's is right in the corner. So I wish everyone on the show a wonderful and successful upcoming new year. 2024 was good, but there were some challenges. I'm pretty sure everybody will have a word or few to say about that. But those challenges always results to get a better preparation and getting other stuff out, together so that the following year could be better. So welcome to the show. So happy New Year in advance. That being said, today we have our guest here, Mohammed Tekanyi. Dr. Mohammed Tekanyi will be leading our discussion today about the way forward for the Gambian healthcare system. Our topic will be way forward for the Gambian healthcare system. So, Mr. T. Kanye, welcome to the show.
Thank you very much for the invitation, and it's an honor to be part of this very important initiative and to contribute the little that I can towards the betterment of our dear country, the Gambia.
Thank you. And then before we start, Mr. T. Kanye introducing himself and getting into the topic, I have my co-host Sam Ceesay. Sam, welcome to the show from Indiana. And I have my newly co-host also here, Ousman Camara. Ousman, welcome to the show.
Thank you.
And
Thank you.
Famara will be joining us in a little bit. So thank you. So let's go right into it. I know the viewers can't wait. This is a great topic. I'm going to be sharing the link. Um, Mr. Tekanyi, Dr. Tekanyi, let's talk about the Gambian healthcare system. Can you just give us like where we were and then of course how things are and the way forward?
Yeah, thank you very much once more. And for the sake of courtesy, I will introduce myself to your audience so that they will know who is speaking and as well be with us along the discussion. My name is Mohammed Tekanyi. I am a specialist public health physician specializing in health policy and management, and I have huge interest in preventive health, particularly at the level of primary health care, which I think is very important when we are serious and are ready to improve the status of our healthcare delivery system in the Gambia and in the global south as a whole package. So for the sake of the question that you ask, I have to say that let's take it back to the First Republic. At the time of the First Republic, we had a very, the emphasis was on primary health care. And in that, that was a very, robust quest for the development of the primary health care, system or level of, delivery of service. And this, witness the training of public health, officers, nurses, doctors, and other allied, service providers. And this was a time wherein you have, dispensaries, across the length and breadth of the country. And although the number of doctors were not that much, but then nurses were given specialist training to conduct and provide services, healthcare services that would have been provided by, qualified doctors. And so that help in strengthening the primary healthcare level or system of the country. But then healthcare in delivery system has three levels. It has the primary level, the secondary, and the tertiary level. In my own way of thought and specialization, the emphasis on the primary level, because 90% of the needs of the people can be addressed at the level of the primary level. And this entails the provision of health education and promotion, the like provision of the basic needs, healthcare needs of the people to prevent them from needing specialist care. It also includes the provision of access to healthcare services. Like instead of someone walking 10 kilometers to a health post or a health center, you provide, a 5 kilometer or 2 kilometer to that health center. It encourages the person to go to the health center to seek care than if it is 10 kilometers. So all those at the primary level help in alleviating the suffering or alleviating the complications that may arise from the absence or poor availability of primary health care. But then the First Republic did very well in that, and they also have some of the secondary level where you have some specialist care like at the level of Bansang, RVT, RVH then, and also Bansang and RVH. We are providing secondary and some other major health centers. But then stopping at the level of primary health care and secondary health care doesn't necessarily help in preventing those that we call escapes, those that will escape from the prevention at the level of the primary health care and secondary health care. The ones that will need complex specialist care will have to need the service of doctors in the tertiary level of care. So it has to go, like together, primary health care, secondary and tertiary care. So the First Republic did very well in, primary health care and some of the secondary care. And when the Second Republic came, it had, strengthened little of the primary health care and enhanced more of the secondary health care, where we have, an expanded group of hospitals, major health centers, training of doctors, blah, etc., etc., etc. However, the provision of care, quality care, is different from quantitative provision of what you need. So what the Second Republic did was they provided more infrastructure, which is important in the delivery of service. But it cannot be in the absence of strengthening the primary health care, because the primary health care is the foundation, is the basis in which the secondary and the tertiary health care stands on. And so when we come to that's where we have, doctors being trained. And today, I was fortunate to be born in Bansang and, being, attended to by Chinese doctors. But not many of us here in this, forum had the opportunity to be born to, and taken care of by doctors at the time. So the chances in which Gambians had the opportunity to be taken care of by doctors was very minimal in the First Republic, but it increased in the Second Republic. And so, in my view, what's supposed to be done now is we have to strengthen the primary health care and also the secondary health care, in which those that will escape the primary care will not escape the secondary health care. And if they should escape the secondary health care, then the tertiary health care will be available that will prevent them from going to Turkey, to India, to Senegal, to wherever, which other places for tertiary care. But if you, say, for example, you provide education on the prevention of malaria, and the people at, Jara, or Bansang, or Nyomi, or Kiang, or Basse know that if we do A, B, C, Y, Z, we're not going to get malaria, and they follow A, B, C, Y, Z, the chances in which the community will have malaria will be very minimal. And if 10% or 5% of that community gets malaria, at the level of secondary care, they will have the treatment for malaria. So they will not have to go to the level of EFSTH for care for, cerebral malaria or complications of malaria. So as, a way forward, we should strengthen primary health care and secondary health care on the basis of our availability in terms of finance and human resource.
Thank you. Wow. This is yeah, this is so substantial. So I see the three healthcare systems that you put out: the primary healthcare, the secondary, and the tertiary healthcare. You did mention that people don't have to go to Turkey or Senegal or other places for tertiary healthcare.
Yeah.
So now, in this republic, and then the evolution of the healthcare system, you already also mentioned that the primary healthcare was strengthened in the first republic, and then the second republic had kind of worked on some secondary healthcare level. However, we still need our primary healthcare to be strengthened. And you did mention also people need to like be educated about the preventive care as well, and then how to avoid some of these things. So right now, the current system, where are we lacking? Where is it that we are definitely lacking, and the resources needed to put in? So that is, we need to identify that. Secondly, also, once we identify where we're lacking, how are this how what are some of the mechanisms that these resources could be put together, or which sources can these resources come from? Would it have to be external donors, or would it have to be internal cuts in the budgets, or or the re-education of our leaders to understand, or as national assembly or as executive to understand how much importance these things are to actually make our healthcare system better.
All right, thank you. That's very important question. So, before I get there, I have to say that the World Health Organization identifies 6 very important pillars of, you know, like realizing the provision of quality healthcare to the citizenry of each country. And the way to implement that depends on the availability of resources in those countries and the way in which they could, pursue the implementation or realization of those, set targets. And so, for example, it will be inappropriate for the Gambia to compete or mimic the way the United States wants to achieve those targets within the WHO pillars. It will also be, inaccurate and wasteful, a pursuit for the Gambia to want to follow the footsteps of Singapore, of Nigeria, etc., because our level of economic strength differ, our levels of availability of human resource differ, our infrastructures differ. And though these 6 pillars are the provision of service delivery, it also entails the provision of health information systems. It entails the provision of finance for the implementation of all the services that are needed in the service delivery. It also entails the access to essential medical supplies. And equally, it entails proper leadership and governance. And so these 6 pillars are important in achieving set targets for the, access, like broad access to healthcare service for, the citizenry. So the reason why I said this is because I want to put out a picture, a picture that we don't have to be like Senegal to say we're going to do this. We don't have to be like the US to say we're going to do this. Already, the WHO gave us a skeleton of what we have to do, like to move from point A to point B. And it depends on us seeing how we could move from point A to point B on the basis of the framework that the WHO has provided. And in doing that, we have to tailor our, set targets and our ways of in that quest on the basis of our availabilities in terms of finance, availabilities in terms of human resource. So, say for example, if the US could build 10 hospitals every 2 years, the Gambia cannot build 10 hospitals every 2 years. So if we say because the US is building 10 hospitals, we have to build 10 hospitals. At the end of the day, we'll have a difficulty of maintaining those hospitals, a difficulty of financing those hospitals, and a difficulty of maintaining the people that will be working in those. So we have to, the first and most important thing we have to do is look at our priority areas as a country in terms of healthcare. Where are we lacking? What should we do to improve the areas that we are lacking? What are the resources that are available in improving the areas that we are lacking in? And then we, design a framework in which we could pursue the realization of those targets within the bigger framework of the WHO. I take your mind back to 2001. The African Union had its summit in Abuja, Nigeria, and they had a declaration. And the declaration was that each and every member state of the African Union would, give at least 15% of its national budget on healthcare. Yesterday, I was checking the budget of our country, the Gambia, in terms of, like providing funds to the Ministry of Healthcare, which is responsible for our service delivery, is 9%. 23 years ago, it was agreed that 15% of the national budget If 23 years ago it was 15%, obviously on a progressive thought, it's supposed to be more than 15% today. But today it is 9%. 9% of our national budget is on healthcare. That doesn't provide the needed possibilities of getting adequate financing, of providing essential drugs, of providing adequate and quality healthcare from primary, secondary to tertiary care. It doesn't also provide needed resources for the leadership and governance, because the healthcare ecosystem has a leadership structure at every level. And to maintain that leadership structure, you have to provide the funding that is needed. And if you provide the funding, you could address issues of corruption. You could address issues of providing essential drugs, essential services to the people. So, on a broader conclusion, the first thing we have to do is to address the issue of budget. We have to provide the needed budget for the healthcare system. The US provides about 32% of its national budget on healthcare. That still doesn't provide the US the level of care it needs for the citizens of the United States, even with 32% of its national budget. How will 9% of our national budget do that when we compare our ecosystem, the US and the Gambia ecosystem? So that's a problem. So the first thing we have to do is to review the national budget. We have to provide adequate funding to the Ministry of Health. And in doing that, we could cut, some spending on other areas that are not priority areas. In my view, there are three very important things that are related in the provision of quality healthcare. One is providing the resources that are needed for quality healthcare delivery. Good agriculture, which will provide feeding and all that kind of stuff, and security. These are very important that are related. Healthcare cannot be taken out of, agriculture. Agriculture cannot be taken out of security. Security cannot be taken away from healthcare. So the three are very important priority areas for the development of any country and for the realization of better healthcare for everyone. So the first thing to your question is increase budget. Second is to tailor our delivery according to our results, what we have in human resource and finance. And the third thing is to strengthen the base of our pyramid. The base of our healthcare pyramid is the primary healthcare level. If you provide me the education that will prevent me from being obese, if you provide me with the education that will prevent me from getting malaria, if you provide me with the education that will prevent me from getting hypertension, diabetes, asthma, chronic obstructive pulmonary disease from smoking, etc., etc., the chances in which I will need secondary health care or even primary health care for primary, care providers will be very minimal. So we have to do that. Number one, provide adequate budget funding. Two, tailor our services according to our needs. And three, strengthen the base of the pyramid. That should be the first start for the government and for everyone involved in, the provision of the service for our people.
Wow. I know I'm gonna let you know. There are some other questions with me, but if we can just uh, ask Dr. Muhammed
Yeah.
Tekanyi questions. I mean, related to any areas that we think need his explanation. I think that would be very helpful. Yeah, Sam, you can come in, Osama and Usman, because I have other questions. Because the pyramid itself, the base of the pyramid, which is the primary healthcare, and then the budgeting, they are really of a concern, and how do we tailor it. The way he broke it down is really interesting. But each of those things have something important to talk about. Yeah.
All right. All right. Well, thank you, Doctor. Definitely for your contribution here and definitely being a guest on this show today. It's very important. And I'm glad. I thought first time I didn't know that you were actually based in Gambia. I thought you were outside, but I'm glad you touched on Gambia very well. So you were born in Bansang, like you said. So great. All right, so you know what is happening in Gambia for sure. You're not a stranger, so that's a good thing. My contribution to this, I'd like to add something and maybe afterwards ask some questions because I have a group called Solutions for Gambia, and I'm the founder of Solutions for Gambia. We talk about problems in Gambia. And one of the things that I've talked about in the past, not once, not twice, not three times, is the healthcare system. I thought the healthcare system need a big reform. And the reform really should start from the top, just like how we want to curtail corruption. We want to start from the top, not the bottom. So in reforming the healthcare system, I think it should come with first, I've said this a couple of years ago, we need to dissolve the current board of directors in the healthcare system and come up with a new board of directors that has a chairman and a board of directors that are all responsible for a certain part of the healthcare system. Once we have that in place, there are different components I thought should happen in the healthcare system. And I'll touch on some of the things that you mentioned, like a budget. Budgeting is very, very important. I thank you, and thank you for bringing that up as well. I think once we reform the healthcare and have a new board of directors, the next thing that should happen, the government really should think about is, I've said this also in the past, the presidential Meet the People's tour should happen. I think they can cut it to once a year, but should happen before the budget, so that when the president goes out, he goes out with the Minister of Health to see what is out there in the country, in places that they've never seen before, and wonder how they get health care. That's very important. They can also see some other places where there are current health centers in there, and see the conditions and what they are in and what they are lacking and things like that, so that when they come out of that healthcare system, I think that's when they come out of that tour, I think the tour needs to happen at least 3 months. If they can do up to 6 months before the budgeting, will be great, but at least 3 months before budgeting, so that while the Minister of Health is out there with the president visiting these places, he can take note of he can go with the people that's going to help him. Some of his people will go with him to be able to identify areas that are in desperate need of health care. All right. It's like, especially like you said, primary health care. So areas that they can identify that, they take a long time. They have to travel a long way to get to the nearest health center. So they may be able to identify that, well, this place so we may need to build small health center here. We're not going to compete with anybody in the world. We're not there yet. We don't need to compete. We just need to provide the basic health care for Gambia. And to do that, you have to be very strategic. And the strategic system would be go visit these places before the budget. So when you come back, the Minister of Health with his team in the ministry and the board of directors, of course, after they reform, with the board of directors can sit down and say, all right, we know for sure place so-and-so is going to need a health center. But we also know that so-and-so place don't even have gloves. They don't even have anything. How can they take care of people? So they can see the needs of the people and prepare their own budget and submit that to Ministry of Finance. So when Ministry of Finance is presenting the budget to the National Assembly, the healthcare budget is already there. They already know what they want to do. They can't solve every problem every day. For the entire year. If you think about it, they cannot provide hospitals build 10 hospitals in a year. I understand that, but one at a time based on priority. Once they identify those priorities, put that in the budget, then the finance minister submit that budget to the National Assembly. Once it get approved, we get into 2025 or the new year, whatever new year that is, the healthcare system already have a budget. They can start immediately, build a hospital in so-and-so place because those people are suffering. But so-and-so place also needs so-and-so equipment. They are suffering. They can't do anything other than referring people. So-and-so place need an ambulance. All of these will be in the budget that's already approved. So as we get into the new year, once the budget is approved, no time to waste. Get them all. Get all of that ready. Order them and bring them in so you can solve problem for those areas. Now, once they do that, that will be a step in the right direction. Now, part of the responsibilities of the board of directors that I've said in the past also is they will be responsible for recruiting of good doctors and nurses. There will be a director for that, responsible for that. There is going to be a director responsible for the inventory of the hospital, inventory management. How can we provide supplies? How can we do that? One of the things that I recommend that they do is do a survey around the world, around the world. Just look at 3 different places that you can compare prices, competitive prices, by looking at, if we had a supply, get into an agreement with a company in the US to supply Gambia medicine, or in Taiwan, or in China, or maybe Sweden, maybe Denmark. But pick 3 different places that they can survey and see who has the best quality products at a reasonable price for Gambia, right? Then choose that to be our partner to supply us medicine, and all the, not only medicine, but every equipment, every supply that we need in the hospital. Pharmaceutical companies, to be able to get all of our necessary needs. Okay, as part of their budget, they will also build good warehouse to supply medicine, to be able to store our medicine in when the supply is coming. So as part of inventory management, I know I'm talking a lot. Once I get into this, because I've said this over and over, that's why I'm just talking. But part of this is you've got to be able to manage your inventory so you don't run out. And some of these companies that we deal with can do an automated system. If they send in, let's say 1,000 Tylenols, for example, I'm just giving an example, 1,000 Tylenols that are received with a scanning system for Gambia to confirm, yes, we got 1,000 Tylenols from the supply that we received. It goes into the system. That 1,000 Tylenols will be dispatched out to different hospitals. In all hospitals, at least major hospitals, need to have pharmacy in there where they will store that. And I recommend that every storage and every pharmacy should have cameras, so nothing get missing. Nobody can take anything out. They should have security and cameras so that nothing get missing anywhere. This is part of our problem. We bring medicine in, people take it, and some will supply their own pharmacy from it. Some of the medicine get disappeared, and we don't know where it went because there's no control, no proper control. There may be control, but the control obviously is not proper control. That's why we're missing all of this. So once they do all of that, then everything that gets out gets scanned. I guarantee you we can account for everything. And also, as a start, I recommended that they have audit system. When you have a large amount of corruption, a huge corruption in the country, and a lot of things missing, you've got to come with a very strategic and strong approach to it by inventorying, doing an inventory audit on all those pharmacies every month until you have a good control of your medicine so nothing is missing. Then you can go to once a quarter, meaning once every 3 months, but not wait till 2 years and audit the place and realize we missed $17 million. What's the point for that? If you do it once a quarter or once a month, you'll be able to catch $500 rather than $5 million after the end of the year. You see what I mean? That way you can take appropriate actions and get rid of the problem, and don't transfer them. Just get rid of the problem. I don't transfer problems. Get rid of them, so that we can at least maintain the proper inventory needed for Gambia. If you go to our main hospital right now, there's a lot of things that are lacking there. RVTH, a lot of things are lacking there. So if RVTH being the central place that every minor hospital, so health centers refer people to, well, and they don't have what's necessary, the tools and technology, it's going to be a problem. So I'm going to end here for a little bit, but I'll come down to it. But there are different aspects for every board of director to be responsible for, to make sure that the hospital operation goes smooth. But we also maintain our buildings. We maintain our equipment. If an equipment breaks down, the board of directors that are responsible for those needs to get the report that certain equipment is down so we can order. But also they can order backups and have them in store. So if one thing breaks down, you have mechanics or technicians that can fix them. But if not, you have a backup and bring that in there. People's healthcare is of paramount importance. We cannot play with it. We cannot go without certain things for months and months and months. So this is the discipline that Gambia needs to have. But like I said, I'm going to stop here. But I think the budgeting for sure that you said need to be done before the budget get passed. The presidential tour need to be done before budgeting so that the healthcare budget can get into that budget and we have all the things that we need. Thank you.
Thank you, Sam. Ousman, do you have any question to add to the comments that Sam gave, so that we can have the doctor also look into those questions? Yeah. We can hear you. You are muted.
Yes, thank you so very much, Mr. Sawaneh. Sam, you did an amazing contribution. Thank you. Doctor Tekanyi, thank you as well for joining this show. Very educative, very interesting for the public, as alluded by Sam and, of course, the host, Sawaneh. This is fundamental for us. I have some few questions that I would like to, you talk us through how best you can elaborate significantly. Tikani, with the issue of the health system so far, let's say for the past 7 years, with the current regime, do we actually receive or do we make any advancement with regards to significant progress as far as the regime is concerned? Is there any impression so far for the past 7 years that you think there is a promising path in the health sector? That's the first question. Please, can you react to that? Thank you.
All right. Thank you very much for the question. But I just want to have a quick review of what Mr. Sawaneh has said. And like I said earlier, there are 6 pillars that the WHO identified as, the carriers or the drivers of quality healthcare for the citizenry of each country. And part of that is the provision of health information system, proper health information system. And if you have, proper health information systems in place, you will not need to go to Bansang to know what is happening there. You will not need to go to Basse to know what is happening there. You could be seated in Banjul, and the institution in Basse or in Bansang or in Farafenye could provide you real-time information on what is happening there, what is lacking, what is available, what is needed. We are in the era of technology, and everybody uses, there is e-health and mobile health. You could sit in Bansang and tell the doctor or the nurse or the director of health services in Banjul that this is what is lacking here, this is what is available, this is what is not available. You could do that without even waiting for the president to go for the tour. And so provision of proper and adequate health information system helps in one, coordination of services. It tells Bansang that, we are, in shortage of ABCYZ. Can you please provide us this before the next subvention comes? If it is available in Bansang, Bansang gives to Farafenye. And Farafenye tells, Basse that we have a shortage of this. Can you help us with this person to come and help us? Maybe it's a specialist. Do you have a specialist who haven't got any, much cases to deal with in this period? Can he also come over to Basse to help for this period? So the provision of proper information system provides coordination of service and also provides real-time updates on what is existing, what is lacking, what is needed, and all that. So you don't need, the president going for a tour to know what is needed. You don't need, the health minister going to Farafenye to know what is happening. I think the major problem is the prioritization of budget spending. That's where the problem is. I am very sure that the Ministry of Health gives out, like what every ministry does. You put out your budget, you give it to the Ministry of Finance. Ministry of Finance reviews the budget and decides to cut some, do this and all the stuff. So the problem will be to address the issue of providing, proper, and adequate budget for the Ministry of Health. That is where the problem is. And if you ask folks out there, they will tell you that, Ministry of Health maybe provides what they think is adequate for the ministry over the period of the year. But the ministry thinks that, finance ministry thinks that we will give, instead of 10 million, we'll give 5 million. And you could manage with that. And instead of, 4 million, we give 3 million, you could manage with that. And that's where the problem is. So we have to, address that. And the other thing is about, the corruption that Mr. Sawaneh spoke about. Sorry, Mr. Sam. Oh, sorry, Mr. Sam. So here is where leadership and governance is important. The healthcare sector has an ecosystem, and just like the political system. So the leadership and governance system has to be right to ensure that proper policies are there, policies that are equitable and progressive. to make sure that, whoever is director in Bansang or in Basse has what is needed for him or her to do what is right for him. The reason why we have corruption is because of inadequacy of what is needed. That is what pushes people to corruption. So if they provided adequate, and this also goes back to the budget. If the ministry budgeted, 5 million for the payment of the workforce, and the Ministry of Finance reduces it from 10 million to 5 million, that will be a problem, because ministry will not meet the needs of those that are providing service. And what will they do? They will seek other means of getting that. And we know how survival is in the Gambia. So, and many other things like access to, quality medication. It's important to take into consideration patient safety. The, manufacturers that are producing or providing those drugs, whether they are maintaining and following standards. We have the issue of, AKI not long ago. So all of these are very important things. The WHO already provide us the tools that we need to follow to do that. The issue is we are not following, either we are not following them or we're not following it as how it's supposed to be. That's where the problem is. So to answer the question about, an assessment of the healthcare system over the period of 7 years, I have to say that there is progress, but there is still need to do better, because now we have a postgraduate medical education in which doctors in the Gambia will be trained as specialists, and when they train, that is important in the development of the workforce, which is very important. So instead of someone coming from Basse to EFST for a surgery, like herniorrhaphy, correction of the hernia, he or she will have it done in Basse because there's a specialist place in Basse. Instead of someone coming to EFSTH for some basic cardiological or minor cardiological issues, he or she has a specialist in Bansang. So in medicine or in healthcare, we take into consideration two very important things: mobility, that is the investment in transporting yourself from one place to the other, the cost and all that, and mortality, the end result of the difficulties or the disease and all the stuff. So if you train more personnel, you reducing mobility and at the same time reducing mortality. If someone will need 5 hours to travel from Basse to FSTA to get a herniorrhaphy, if there is a surgeon in Basse, he or she will not need that 5 hours. And maybe during the period of 5 hours, he may have died in that process. The ambulance may not have fuel. The road may not be good, and all that kind of stuff. So the government is doing well in the initiation of postgraduate medical training, in which they train specialists. And the objective of that is to train as many as they can to increase the pool of specialists, and then post them to the regional hospitals. That my people from Jara will not travel from Jara to Banjul or Kanifing to need some specialist care, which could be done right down there. That's number one. Number two, they also trying to improve infrastructure, which is very important in healthcare. We have seen the building and opening of new healthcare centers, and also the development of road network, which is very important in healthcare because mobility is related to that, and many other things. But then they're also doing well in terms of training of people. We see that folks have been sent to develop skills, train, and also provide a wider platform for advancement of the healthcare delivery system. However, I think they could do better. Like I said initially, we have to maintain the quest of strengthening our primary health. That is where all the problems. People will need to go to the specialist when they miss the knowledge of how to prevent, when they miss the treatment of the problem at its infant stage. For example, we have issues of maternal mortality, women dying from during childbirth. But if you have a strengthened primary healthcare system where the pregnant woman knows that I have to go for regular antenatal visit, and in my regular antenatal visit I have to have regular laboratory work to know the level of my hemoglobin, to know whether I am at risk of bleeding, to know do have scanning to know the situation of my fetus, and then whether I need supplemental nutritional medications to help with the nutrition of my baby and all the stuff. But if that is not strengthened, and the woman in Basse or in Jara doesn't go to the health center, only when it is time to deliver that she get complication. Rush to Soma cannot do anything. She's rushed to Banjul. Before she gets to Banjul, she's already tired and may have died. So strengthening the basis, or the base of the pyramid is very important. And I think the government of the day should look into that. And also strengthen the secondary healthcare, delivery system, the secondary level of it. That will help in, prevent, like I said earlier, 90% of the issues or problems relating to healthcare could be addressed at the level of primary healthcare if it is adequate and of quality. So if 90% could be addressed, 10% will escape that to secondary. If the secondary could address 7%, only 3% will go need tertiary care. And if 3% will need tertiary care, the percentage in which that 3% will end up dying will be very minimal. But if 90 could have done it and only 60 is done or 50 is done, that means the exodus will be huge, and then it will burden the tertiary care where resources are inadequate, poor electricity supply, inavailability of resources, consumables, poor pay of staff, and all that many problems. So the issue is they're doing well, but they still have to do more to help in bettering the status of our healthcare delivery system.
Sorry, Sawaneh, I still want to come in there. Ms. Tekanyi, can you suggest something, or can you make recommendations? Will you agree with Sam Ceesay that the board of directors at the health sector, they should be wiped out? Then we have new faces that will come in, maybe to address some of the challenges that you have outlined or that you have stressed. Will you agree with Sam Ceesay on that, or do you have a different version of recommendation? Thank you.
Very good. I do like. It's not necessarily getting everybody out, but like I have a list of recommendations that I think could help in bettering our status. Number one is the provision of adequate financing so that it will meet our budgetary needs in terms of healthcare. That's number one, because that will help in addressing a lot of issues. And number two is like what I earlier said, strengthening the base of the pyramid, ensuring that people are not sick, ensuring that even if they are to be sick, they will not get to a level where it will have already been late. That is two. That's very important. Number three is the training of staff. Quality of service delivery is very paramount in healthcare. It's not about quantity. We could have as many hospitals as possible. If they do not have the quality that it requires to be a hospital, it will just be a structure. It will just be a structure. So we have to train as many as possible. And in training as many as possible, the training should be directed to what our priority needs are. So if our current needs are educating our people on how to prevent malaria, on how to prevent maternal mortality relating to bleeding during childbirth, on how to alleviate corruption, in training people to be good policy makers and managers, and also training people to provide the primary level or first level of specialist care. That will help. And the other recommendation will be, there's something very important in terms of healthcare. Two very important things in life that are inevitable. One is ill health and death. They are inevitable. Every one of us are waiting for that. The timing of it, we don't know, but they are two inevitable things. We will get ill at some point in time, and we will die at some point in time. But the best way to overcome that is preparing for them. And in terms of healthcare, here is where health insurance comes in place. The reason why a lot of people, struggle and have, lead to complications that they cannot, correct is because of the cost of the care that they need. They didn't prepare in advance for ill health. This is why in the Western world, in America, for example, here, you have, priority in getting health insurance. Even those that cannot have health insurance, the federal and, state and, city governments try to provide all that they could have access to healthcare without that burden. Because if that, readily the readily, availability of the services is not there. When someone gets sick and goes to Banjul, he's told that he has to get medicine. He haven't budgeted for the medicine. He will have to run around. Maybe before he gets the money for the medicine, he will have already been late. But if we prepare in advance for ill health by getting universal health insurance, and I have been advocating about this, I said we have a tax-based system of generating income, a tax-based economy. And we have different ways of getting this. We have people that are engaged in rent, those that are working in the private sector, in the public sector, and all that. We could incorporate ways of contributing to the insurance through the means that we get this tax from. If you are, not in the public or private sector, but you are doing business in terms of, rental business, the government, through a system, will place in an amount that you contribute to your health insurance from that, the tax that you are paying for the rentals. The women that are selling at the market will have a percentage, maybe 0.5% or 1% will be a contribution to their health insurance. So if she or he gets sick and goes to Banjul, will know that I'm not worrying anymore about what I will pay for the medication, what I will pay for the service, because that is already been taken care of. And so that will also help in telling the person to go to the hospital. Some of them get discouraged of going to the hospital because they cannot have the cost. Because you don't have to blame them because they don't have it. So if you provide health insurance, universal, health insurance that prepares for their ill health, they will go in for, the care at a very early stage and will help in preventing that. And also, it is also important to develop quality. We could build as many hospitals as possible, but we have to look at our priority. We already have regional hospitals. And if we have regional hospitals, we have to have a measure on what is the distance say, for example, in Sarakunda, for example, what is the distance that people have to travel to a healthcare facility? If the distance is, an acceptable distance, there is no need to build another hospital. Instead of building a health center or a hospital, we have to strengthen the existing hospital there or a health center there and provide a health post. That will be a link between the people where they live and where it is provided. But if you build 10 hospitals in a community of 100,000 people or in a community of 50,000 people, it is useless because there is no, need for that amount. So quality is very important. And in assessing quality, you have to look at the distance that people have to travel to where the services are provided. And also, it is also important to provide, like I said earlier, the primary problem of corruption, not just in healthcare or in all sectors, is inadequate, intake or inadequate take home. So we have to look into that, provide, what is more than, little for those that are providing service that will prevent them from engaging in corruption, from reselling medications like Mr. Sam has said, that, is meant for the people, for, diverting the budget that is provided for the purchase of, equipment, diverting the budget that is needed for whatever it is, and the endless workshops that they are doing. Each of those workshops come with allowances and all that. That could be a way of getting money because they are not having enough take back home. So we should look into that, provide enough that will prevent people from, taking what they're supposed not to take. And lastly, progressive policies that are going to move us from, good to better and from better to best, and not policies that will stagnate us or not policies that will cause retrogression. So progressive policies, provide policies that will make, provide advancement. That is very important.
All right. Well, thank you. I still want to come in. I think I agree with Dr. Tekanyi in some areas, and in some areas I don't. So, but that's what this is all about. We talk. I know if you're in Gambia, those working for the government will always speak about the government. I am an independent person. I can say anything I want because I don't work for the government. So, and that's this is part of the reason I actually wrote a proposal. I wrote a proposal that maybe at some point, if things that I've said and over for the past years, if the government start to implement them, I may be able to try to meet with the chairman of the board of directors and hand them my proposal and say, here is something that I voluntarily made for you, so you can take this and see what you can add or take out of this and make something out of it. So first, in my proposal, all the things that you said, or some of the things that you said, are part of my proposal, which is an electronic system. In my proposal, I even said when a sick person walk into the hospital, they go straight to registration desk and enter everything on the computer, not on paper. So that was part of my thing. So everything in the hospital has to be computerized. So that's one of the things. The other thing is the reason why I wanted the board of directors dissolved, because we're not getting the progress. I mean, Gambia is 59 years, almost going to 60 years in February. We are still way behind time. Why? Because we don't have that. It's not because of the lack of funding. Lack of funding is one thing. And I'll tell you this, and I can guarantee you this. Even if you take all of Gambia's budget and put it into healthcare, I guarantee a lot of it will be stolen. Because why? There's no control of the funding. Even if it's a little funding, if you have control over that little funding, you can manage with that. There's no control. The lack of control is why we're missing some of this. It's not lack of funding. Funding is there. Yes, inadequate funding. That is true. I agree with you on that part. They're not funding the hospital correctly. But like I said, even if they give them adequate funding, even if they give them the entire Gambia's 52 billion budget and give it to them, it will be all over the place. People will take bits and pieces, and we will still lack some things. I can guarantee you that. We've got to have the mechanism in place. That's why I proposed a dissolve of the current healthcare system, the board of directors, bring in a new board of directors. And in the board of directors, I'm going to expand this now because you talked about some of the things. I think I'm talking more of the structure, the infrastructure of our healthcare system, and you're talking more of the internal operations. And I agree with you on the internal operations. Everything you said is good on the internal operation, but we've got to structure ourselves first to be able to maintain the internal operations. So if we structure ourselves by having a board of directors, in that board of directors, now I'll expand this part, there should be a director that is responsible for supply and inventory of the hospital. That will have people, managers under him that will work with him to make sure that adequate supply is coming. There should be, under the board of directors, there should be a section or department that it is responsible for recruiting, training, and development of our doctors and nurses. So that will take care of that part too. And I know you talked about training, but this is all part of my things that I've talked about in the past. So if you have a board of director responsible for, in the board of directors, you have a section that is responsible for recruiting, training, and development of doctors and nurses, we will have every specialty that we need for every hospital that we have. You should also have a director on the one board of directors. You should have someone responsible for the electronic system, the IT system, to make sure that the government function electronically from the moment a guest or a patient walk into the hospital, the computerized system that's going to register them to all the way to where the doctor prescribes a medicine that gets into that, drops into the pharmacy's computer system. That guest or the family can go to that pharmacy and be able to see that that medicine is available. They can collect it, and even a doctor in Bangsang can see that Dr. So-and-so prescribed so-and-so medicine for patient so-and-so in room so-and-so. All of it will be there. That's what I meant by computerized system. So now we should have under the board of directors, they should be responsible for maintaining that system and frequently, as time goes on, upgrade that to go with the technology, so we're not left behind anymore. Like I said, we are already about 60 years old, and we don't have these in place. So then, under the board of directors, they also have to maintain all of our infrastructure, the buildings. If you go to the different hospitals today, you will see cobwebs all over the place. You will see beds that have been there for over 100 years, and I'm just saying that not 100 years, but I'm just saying that how old the beds are. And you will see some places that don't even have a bed. People are sitting and laying down on the floor. You will have some places that people are sharing the same bed sheets. Bed sheets are not getting worse, or they're not getting changed. So you will have under the board of directors that will be there to make sure that those necessary supplies are available in every hospital. A hospital should be treated like a hotel. One patient come in, just like a hotel, a guest come in, their bed and everything in their room is all set, all freshly made. The moment they leave, they strip that bed, the bed sheets, the pillowcases, the everything gets stripped and taken out. They clean and sanitize the whole room, and then make fresh bed sheets for the next person. Hospital should be treated like a hotel, just like that. And cleaning includes all the walls and all that. But so the other part is hospitals should have their own maintenance system in place. When I say maintenance, a department that will be responsible for all the technical stuff in cleaning, that will all be under maintenance. You should not walk into a hospital and see 2, 3, 4, 5 light bulbs out. We should have maintenance in place that will be walking every day. They will be changing those light bulbs. They need to make sure that all of that is available. They need to make sure that if there is a crack wall somewhere, maintenance department need to dispatch a mesonet to go in there and fix that crack. A painter follows him and paint it back, so everything looks new every day. This is my proposal. This is what I said about all of that. And not only that, the board of directors will also make sure that as part of budgeting, they have at least 2 standby generators for the hospital. When power goes out, automatically the generators kick in. We don't even go for 1 minute without electricity. So there is a lot, it's inclusive. There is a lot of stuff in my proposal. There is a lot of stuff that I talk about. And some of it is, I can't write every single thing, but I did write a proposal. And that's why I said, if I can get a chance to meet with the new board of chairman, director of the board of directors, I will be able to not only present them my proposal, but also be able to elaborate on some of the things. What do I mean by this? What do I mean by this? Just like some of the things that I'm just saying. So there is a lot. And the reason also I said the president's budget, the president's store and the budget, I don't mean it for, I wanted us to really set the infrastructure. Once we dissolve the board of directors, have a new board of directors, this is where we start the stage. We need to make sure that the tour of the President's Meet the People store goes with the Minister of Health, because healthcare should be one of the priorities, the top priorities for our country. Right now, today, if you ask anybody in the Gambia, they will say healthcare and the economy, the cost of living. These are 2 things that people want to have. So that's why it's important to set the stage the first time when we do this reform, healthcare reform. First time the president is going on a tour, should happen before the budget, so that the healthcare system, the people can see all the things that we need that can be included in the next budget to set us apart, to set the stage up. And they don't have to do that every time, but it's important actually, because otherwise you're putting the cart before the horse. If you make a budget, but you don't know what's out in Bansa, you don't know what Kaur has, you don't know what's in Chamin, you don't know what Dankunku has, you don't know what's in Jarasoma, you're making a blind budget. So you're not gonna provide adequate supply or budget for these hospitals because you don't know. You made a blind budget and you take it to Minister of Finance, they cut it. But if the president go with them prior to budget, Minister of Finance can go, Minister of Health can go, to see that these are basic necessities that we really need to do. Even if it means president cuts your budget, your own state house budget, cut it so that we can have the healthcare of the people, because the people have the power. Power belongs to the people. People are the ones that elected the president to be in place. So the president needs to do his job. I'm not talking about President Barrow. I'm talking every president Gambia ever has and will ever have. That is part of their job, to be there to make people's lives better. That's their job. Not to go to the State House to enjoy and make big budgets for the State House and enjoy and do all of those things when the people in the provinces are suffering. You see what I mean? So I want the proper infrastructure set first, then we can worry about the internal. But when the infrastructure is set, that comes along with some controls, some control mechanism, people responsible for overseeing every every aspect of the hospital administration, just to cut it short. That way, the people now in the hospital, the doctors and nurses and all the staff can do their job and not lack anything, because they will have what they need, the adequate supplies that they need, they will have it, but there is going to be control for those supplies. Nobody can even take a towel out. Nobody should be able to take a box of Tylenol or medicine or children's medicine out and be missing. And just to elaborate on that too, that's part of the reason I said when the board of directors do their survey with 3 different countries or pharmaceutical companies that makes hospital supplies, get into an agreement. Nowadays with technology, that pharmaceutical company can see the inventory level of Gambia in their computer system, because their computers are going to be linked, so that when the last delivery came with, let's say I gave an example of 1,000 Tylenols, they can see that out of that 1,000 Tylenols, 15 has been transferred to, or 20 has been transferred to Bansang, 10 given to Farfenye, 10 given to Kudang, 10 given to Basse. They can see that, and those are being used as they're getting depleted, that there will be an automated system, an auto replenish, automatic payment replenishment system. So that pharmaceutical company will see that they're going to need more. So their computers, when the pharmacy or the hospital is ready to place supplies, it'll be automatically generated for them. With a touch of a button, they can auto-generate the hospital supply list, and they will have the ability to add something to it and submit it. It'll be in that pharmaceutical company's computer, and they will send the supplies before we run out. But there's going to be control. Like I said, control mechanism is very important. If not, they can send us the whole world's supplies of medicine and the hospital supplies, and it will be all gone because there's no control. That's what I wanted to say. Thank you.
Thank you, Sam.
Yeah.
Before I know we are about an hour
has into the program, and then our host, I think I have agreement was like one
I
hour.
want in response to that.
Yeah. So
Yes.
I know
Thank you so much.
we are within an hour. So, but before our guest comes in, so we can wrap it up. I just have one area that I want to elaborate on, which was mentioned by Mr. Dr. Tekanyi. That is the universal healthcare. The universal healthcare model that he spoke about. Having that implemented in the Gambian, healthcare system is what I've been thinking about all this time. Because if you look at the United States, you have the universal healthcare system here that helps citizens in health coverage. It has huge expenses. The expenditure that goes to the healthcare system is footed by mostly by the taxpayers. So how much money the taxpayers provide towards the Gambian economy, Gambian budgets that will be able to cover individuals who cannot afford. Because the poverty level in the Gambia is so high that if everyone should be able to get treatment because they cannot afford healthcare, I mean that who's gonna where are you gonna get that bill footed? Where is that money gonna come from? Because if you look at the amount of taxes being collected, based on the corruptions and other things that happen within the system, how could you even have money to cover the health expenses of the citizens? Who cannot afford it? So this is the reason why when the president mentioned that he would provide healthcare system coverage for citizens, I was confused. You can't even basically do much, with some of the things that we have, in terms of medicines, in terms of other facilities when it comes to healthcare. How can you even come and say, you're going to provide healthcare system for the citizens? So I think this is one area that we also have to look at, because basically I know when people go to the hospital, they do pay. Some people, if they don't have, they would rather don't buy the medicines, or they get keep getting sick, or maybe they have their loved ones abroad, who would help them. If they don't have that, then they are stuck. So how do we solve this problem on average citizens who need, to give them health equity and what they need to be healthy? Because everybody's level is different. If Usman can afford, you know, 10,000, 20,000 to get treated, the party cannot even afford, 2,000. So, but party need the same level of health treatment, in order to serve as an equity, like Usman. So, how can you make up parties 2,000 to 20,000 to be able to get the same treatment that Usman got? Because Usman already can afford his, and they are all citizens. So, health equity and then healthcare, coverages and so forth. How how can we solve that issue in the Gambia? Aside from politics, because I know politicians would say anything just to get the votes or get people hear what they want to hear. But realistically, how could this problem be resolved? I mean, how could we take care of this problem compared to the current problem? That would be my last question. Thank you.
Good. Thank you very much for the question. But before I get into that, I just wanted to have a review of what Mr. Samad earlier said regarding the board of directors. The Gambia has a very structured healthcare system, not just the internal but external, and this has been for ages. I could say since independence. We have a director of health services, which have under it directorates responsible for the different areas, nursing, public health, pharmaceutical, and all. So it has that, and below that it also has regional directors, all of the regions of the Gambia, and below that it has CEOs of hospitals, who directors of hospitals, has officers in charge. So it has a very structured healthcare delivery system, and this has been since independence. However, like I said earlier, the challenge to the functionality of that system from the outside to the inside is the provision of regulations and policies that will guide the activities of each and every director, board of director of health services, directorate heads, regional directors, heads of hospitals, etc., etc. Regulations in place that will guide them, that ABCYZ is what should be done. If ABCYZ is not done, these are the consequences of not doing ABCYZ. And from the director of health services right to the head of the hospital, to the head of the dispensary, to the head of the national pharmaceutical service, who is responsible for the procurement of medications. So these are regulations. So we have a director who is responsible for the national pharmaceutical service. So if we have regulations that tells him or her that this is what you're supposed to do, these are the essential drugs that must not be, out of availability. There must always be adequate supply of these essential drugs based on what we have found out on the needs of the people. And then the director of health services knows that these are the needs of the people based on what is given to him or her from the different directorates within him, and also from the regional directors at the level of the regions. The regional director in North Bank will know what are the morbidities, the issues relating to morbidity and mortality in North Bank region. And these are the things that we're supposed to do to help in alleviating these problems. And so he also communicates that to his directorate. The directorate knows that this is what is happening and communicates that to the director of health services. That way we're going to help very well. One of the problems of the EFSTH or the tertiary care in general is because we almost doing everything at every level of hospital, which is not helpful. We have to have a differentiation. Like I said earlier, primary healthcare, secondary, and tertiary. We have to have a differentiation that will help in how much we will need in spending and how much we could do in improving quality. If Canifing is doing the same thing as what EFSTH is doing, we will spend more in doing the same thing. But if we have a specialization in which EFST does this and Canifing does that, so you will know that if I want this, I will get that at Canifing. Except if, at a level where Canifing cannot do this, I know that I'm going to EFSTH. In that way, we will do very well. And one thing to help in doing that is providing autonomy to the hospital. At the moment, all of these hospitals depend on subvention that is given to them by government. And some of the subvention that is given is not adequate. So what happens if they give them a subvention for a month, which takes them for only 2 weeks? What will they do for the other 2 weeks? That is why you will not have light bulbs. That's why you will not have adequate bedsheet. That is why you will not have fuel for the generator. That's why you will not have consumables. But if you give autonomy, say for example, I have been advocating about this. EFSTH and Canifing could be merged into one hospital. EFSTH in Banjul becomes the medical and surgical hospital. Anything that you need regarding medical and surgical at specialist level will be available at EFSTH. You don't have to go to, like when you get there and it is not done there, you know that now I have to go abroad or elsewhere. And Canifing, which is the general hospital there, could be turned into a maternal and child health hospital. That everybody who exhausts whatever he or she has to do in terms of maternal and child health care at Farafenye, at Bansang, at Buyam, at Birkama, will know that if he or she goes to Canifing, he should be able to get it there, because that is where specialist care on maternal and child health is provided. But at the moment it is. Canifing is doing what EFSTH is doing, and the ministry has to give subvention to Banjul, to Canifing and EFSTH for doing the same thing. That is not helpful. So giving them autonomy, if you give EFSTH autonomy and you merge it, EFSTH now gets a board of it. It has a board, but the board doesn't have that power as a real board has, a real board will be. So if you give them full autonomy, they have a board, have its own management, administration, and the like, decides on how to generate income, how to use the income that they generate in the provision of service. We see in the West and in the US, for example, hospitals provide other means of generating income and not only dependent on what the patients pay as cost of service. You go to the hospital, you see dispensaries, where they sell other kind of stuff and all that kind of, and even have levels of residence for patients. All of that is a way of generating income to complement what is available. So if we give EFSTH full autonomy to manage itself and not being dependent on subvention from the government, it will do way better. And then the government could concentrate on the regional hospitals, so they could help in managing those ones, whilst EFSTH and Canifing have full autonomy in managing its healthcare delivery, providing adequate service, managing its budget and service and all that. Because at the level it is now, government decides on how much EFSTH should charge for a ticket, how much they could spend on medication and all that stuff. But if they are independent, they will decide on how much should we charge for a ticket to meet the needs that we have, how much can we charge for the cost of X-ray, of blood work, etc., etc. Another alternative will be, if we are not giving EFSTH full autonomy, we could privatize the different sectors of the hospital to provide standardization for a period. Say, for example, we'll say we're going to privatize the laboratory service for a period of 5 years. And in the period of 5 years, we will have a percentage. The company that will be responsible for the provision of quality laboratory service delivery will take this percentage of the revenue. The hospital will take this percentage of the revenue. And the reason why we're doing this is because we want to standardize the service that is provided. So if you do that for the laboratory service, nobody will go to the hospital and not have readily available service in terms of laboratory needs. You do that for the pharmacy, no one will do that. So after a period of 5 years, at the expiry of that partnership, the hospital would have been already in a stage wherein it could provide that standard. And that will be helpful in helping improve the standard of service delivery. And we could do that for all other departments where it is lacking. Like you go, X-ray is not available. Why? Because there is not enough funding to provide the needed consumables. You go to the pharmacy, medications are not available because there is not enough. So if you privatize, someone in the US, a Gambian in the US could say, I want to take over the provision of medication for the EFSTH. So I'll provide readily available medication, essential drugs for EFSTH. And this is the percentage that I will get. This is the percentage that the hospital will get. After 5 years, we could decide on renewing that agreement or terminating that agreement. Before 5 years, people will no more have that idea of or thought or complaints of because the medication is available, because that is part of the agreement of the partnership. You do the same for laboratory. The issue of medications are not available, services are not available, will all be history because they will be available. And that's the importance of providing the partnership. And the other thing is regarding, resource allocation. Like I'll keep repeating over and over. The reason why resources are not available is because the people providing the services are not given enough. They will have to find other means of getting what they will need to meet their needs. And that's where the problem is. So we have to address that issue, provide adequate, if not adequate, but what is bare minimum for, for the people providing the service, and that will help very well. And about the question, in the US, there are 3 ways of providing insurance. You have Medicaid, you have Medicare, and you have private health insurance. Majority of folks in the US who are working have private health insurance, either from their employer or other means. And the other 2, which is Medicaid and Medicare. Medicare, provides for those that are 65 older, and this is through a contribution that they make during the period that they were working. So they will get, free health care from 65 until the time that, they die. And Medicaid for those that have special needs, like pregnant women, kids, those with disabilities and the like. We could do similar in the Gambia. We could provide, stages of health insurance coverage, not just health insurance in the name of health insurance, but health insurance in its quality form. Say we have whatever name we give it, the insurance that will provide free health care for those that are 65 and above, but they must have contributed to that during the course of their work. They could do it at at the level of the private sector where they work in, or in the public sector, where they could contribute to that at the age of 65 or age of 60, depending on what, level that we want to cut it as a, peak. They will have free healthcare until when they die, because those are the people at the extreme age, 65, 60 and the like. And we could have kid, Medicaid, in which this will be for special needs, people that have special needs, like the pregnant women, the kids, those with disabilities, and etc., etc. We could do that as well. And this will be contributed to by the workforce, both in the private and public sector. So if they are contributing, each person is contributing 1% of, his or her monthly, wage or salary, 0.5% goes to Medicaid. That is for those that get to 65 or above, or whatever age we put it. And then 0.5% for those that are having special needs, pregnant women, kids, those with disabilities, etc. So in this way, we are funding both the provision of healthcare, like the cost of healthcare for those that have special needs, and at the same time, those that will be at the extreme age. And then the bigger group will be gaining health insurance from the private sector. So majority of those that are working in the public sector could have it through their work. So their employers could decide 1% is given to the government for those that are, special needs, and the ones that will be at the extreme age. And then 2% or 3% is for your private health insurance. So if you work at Gamtel, for example, Gamtel takes 3% or 2% or 1.5% from your salary every month. If you get sick, you go to the hospital, Gamtel's insurance covers everything for you. You don't need to worry about the cost of, medication, consultation, laboratory work, etc., etc. And if you do that, like, the previous speaker has said, you will alleviate a lot of the worries that people have. And the reason why we have inequality in the access of healthcare is the cost. So if we address the issue of cost, we're going to reduce the inequality gap, and that will be parity in access to healthcare, and that will also help in minimizing morbidity and mortality. And all this could be done through proper policy, formulation and implementation. Policies that are formulated on the basis of what is available, on the basis of our social structure. In the US, they have what we call Healthy People Initiative, which was initiated in 2020. And the Healthy People Initiative has what we call social determinants of health. And the social determinants of health identify priority areas in the social structure, which contributes directly or indirectly to the health and well-being of the people, like access to quality education, access to safe neighborhoods, access to community building and family building, etc., etc. We could have our own. Instead of calling it Healthy People Initiative, they have what they call Yoruba Initiative, which is very good. That Yoruba Initiative could, if it is not already like mimicking the Healthy People Initiative, it could do similar and look at priority areas in terms of our needs, and on the basis of what we have available, and then tailor it that way. That will help our healthcare system and do very well in minimizing the gap between access and provision of quality healthcare. Thank you.
Wow, that's a lot.
Yeah.
But my
Thank you.
final word, I just want to say my final word. I think we are past the time now, time limit. We need to get to the end of this.
That's right.
Can you all see the screen? Can you all see what I shared on the screen? I'm not going to talk about all of it.
Yeah, yes, of course. We can see from the screen.
So I wanted to clarify that. As you can see, number one is to restructure and dissolve the current board of directors and start fresh. And number two, the role of that board of directors is to provide policies and procedures. I wanted to make sure that we know that they have to be the ones that are going to provide the policies and procedures of the entire hospital healthcare administration. And all the things that you said, Dr. Tekanyi, are inside the body of this this proposal. So this is a proposal I wrote. So I was just talking because I know I've been talking about this. So I decided to just go on my computer and pull it out, so that I can show you guys that I did have a proposal. So, but at the end of the day, I just wanted to say that, and we really appreciate your time. And I think my concern is Gambia is about 60 years old. We cannot continue to do the same thing over and over and over. We cannot say, yeah, we do have this, we have this, but people are not seeing the difference, which means then we need to change. Because if we continue to do the same thing over and over, yeah, we do have this, and that, but they're not doing the job. They're not performing. They're not satisfying the people. We need to change. And that's where my proposal come into place. If we put that change in place, put the infrastructure of the healthcare system in place, a lot of things are encompasses in that. A lot of things are inclusive in that. So thank you all very much. I appreciate your time. That's my final.
Thank you, Sam. Thank you for that. And Ousman, do you have anything final before Dr.?
Oh, thank you. I wanted to say, Dr. Tekanyi, thank you once again. You really did justice to our discussion, and we are really proud. We hope to have you again, because we cannot exhaust everything today. And really,
I was going to say the same thing. Yeah.
Because we have exceeded. We went to beyond the normal 1 hour timing, because it's now 1 hour 22 minutes, which is really unfortunate. But because of the interesting part of the discussion, so we apologize, and we hope to have you back. From me, Ousman Camara, co-host, I say thank you so very much for accepting our invitation, and we hope to have you once again. Thank you so very much.
Thank you, Ousman. Thank you, Sam. And then thank you, Dr. Tekanyi. The discussion is definitely, this is just a segment of it. It is bigger than, we could imagine. We will have, this discussion again. Like I said, health sector is really important. And then, the information given, that's the key here. The primary health, level, the primary layer is actually something that I think, if anybody needs to be focused, that should be a key, so that we can prevent, the secondary and the tertiary level. So that's something that's a lesson that is learned. And then definitely on our next discussion, maybe we can really try to see how that could be mitigated in details. But thank you so much for coming, and really this is a great opportunity to share this information. Your final words.
Thank you very much for the invitation, and like I said, it is an honor to be part of the discussion and see how best we could help in improve the status of our healthcare system, which is a primary responsibility of all of us, those in and those that are outside. Thank you very much once more, and have an excellent day.
Thank you.
We appreciate you very much, and we'll look forward to having you again. Thank you.
Thank you.
Thank you. Thank you. Thank you. Thank you.
Thank you.
Thank
Thank
you.
you.